Hey everyone, we're going to jump right into something that's affecting all of us, the massive digital revolution happening in healthcare. From your doctor's office to the biggest hospitals, everything is changing, and we're here to break down what it all means.
I mean, think about it. Your doctor's office is going digital. You're getting emails, texts, maybe you're even logging into a patient portal. It's super convenient, right? But it begs a really important question. Is all of that incredibly sensitive health data truly safe up there in the cloud?
So why is this happening? Why is every hospital and clinic rushing to digitize everything? Well, it really all boils down to three big promises, the key goals that are driving this entire technological shift.
Okay, so first up, it's all about better communication, which hopefully leads to better health outcomes for you and me. Second, hospitals are trying to slash their operational costs. I mean, getting rid of all that paper and those old clunky systems saves a ton of money. And finally, it's about finding a smarter, more sustainable way to manage files instead of, just endless rows of filing cabinets.
All right, so let's get into the nitty-gritty. What are the actual tools making this revolution happen? Because each one is kind of a double-edged sword. They offer amazing potential, but they also come with some serious trade-offs we need to talk about.
The foundation of this whole thing, the absolute bedrock, is the electronic health record, or EHR. Just think of it as the super smart digital version of that old beat-up paper folder your doctor used to have. It's designed to be a living, breathing document available in real time to anyone who's authorized to see it.
And the promise here is something you can actually feel. It means you get your lab results faster. You can log into a secure portal to see your history. Your prescriptions get zapped straight to the pharmacy. And for the wider medical world, having all this data in one place is an absolute goldmine for research that could lead to huge breakthroughs.
And this quote just hits the nail on the head. At UCLA, they started building the patient's actual story, their life, their experiences, right into the digital record. It wasn't just about numbers and test results anymore. It really shows you that when this is done right, technology doesn't have to be cold and impersonal. It can actually help humanize medicine.
Okay, so you have all this digital data, but where does it live? Well, that brings us to the next huge piece of this puzzle, the cloud. That's the magic that lets a specialist across the country look at your chart or lets you pull up your records on your phone.
And just to give you a sense of scale here, this is not a small trend. The market for healthcare cloud services nearly tripled in just 5 years, jumping to a staggering $9.5 billion. That just goes to show you how all in the industry is on this tech.
But here's where it gets really interesting. This slide lays out the fundamental dilemma. On the promise side, the cloud is amazing. It's cheaper to start, you can scale up as you grow, it's great for disaster recovery. But the peril side is just as real. What happens if the internet goes down at a critical moment? What about cyber attacks and malware? And how do you make sure you're following strict privacy laws like HIPAA when another company is holding all your data? These are tough questions.
Now let's bring it all the way down to the most personal level imaginable. We're not just talking about big hospital servers anymore. This revolution is happening right there in the palm of your hand, with the phone in your pocket.
And this is where things get genuinely a little scary. A major study found that more than a third, 35% of the devices professionals use for work, like tablets doctors use to check patient records, had zero mandated security measures. None. That's a massive, glaring vulnerability. So the risks here are coming from everywhere. You've got data leaking from unsecured apps, you've got staff being tricked by social engineering scams, and you have the simple, classic risk of a phone or a tablet just being lost or stolen. For an IT manager, trying to lock all of this down is a huge, huge challenge.
So when you put it all together, the EHRs, the cloud, all these mobile devices, it leads us to some really critical, tough questions that healthcare leaders have to answer as they try to figure out the future.
First off, there's the money. Yeah, the cloud can be cheaper to start, but as your data grows and grows, so do the bills. So how do you control those skyrocketing costs without putting the brakes on the very innovation that you're paying for?
Then you've got that classic tug of war, convenience versus security. Of course, we love how easy mobile health makes things, but how do you balance that convenience against the absolute, non-negotiable need to keep patient data safe and secure?
And finally, maybe the biggest question of all is about fairness. Are amazing new tools like telemedicine going to help close the healthcare gap for people in rural or underserved areas? Or are we accidentally going to create a new kind of digital divide, leaving some people even further behind?
And that kind of leaves us with this one final thought.
The whole promise and peril of this revolution really hinges on this idea. The goal can't just be about getting rid of paper. It can't just be about moving to the cloud. The real test, the ultimate goal, is whether we can use all this powerful tech to put the human patient back at the absolute center of healthcare.